Today's topic is vitamin D. Those who have the textbook, please mention the page number of this chapter in the chat box. Those who have the new textbook, the new page numbers. 323 is the page number in your nutrition science textbook. 323. So if anyone is joining late, please help them out with the page numbers or topic name. So starting the session. So vitamin D, it helps your body to grow and develop normally. Okay, a very important nutrient when it comes to children's nutrition. Okay, if they want to grow, increase their height. Okay, the prime growth period in any age, vitamin D is a very important nutrient for that. Okay, it helps your body to absorb calcium, and calcium is one of the main building blocks of your bone. Okay, if you don't get enough vitamin D or calcium during your growing period as a child, you will not reach your average height that you're supposed to. Okay, that genetically you were supposed to be of this much height, but because of your malnourishment in vitamin D or calcium, you could not reach that height. Okay. So lack of vitamin D can also lead to bone-related diseases, osteoporosis, rickets. We will see that later in the slide. Okay. It also has a role that it plays in terms of your nervous system, your muscle, and also your immune system. Okay. Your muscles require vitamin D to move for contraction, relaxation. Okay. That's what the movement of muscles is. Because each and every muscle in your body can contract and relax, you are able to move. Okay. You are able to make a movement. For that contraction and relaxation, vitamin D is required. Okay. Your nervous system, your nerves, okay, it requires vitamin D to carry some messages between your brain and your body. And your immune system also requires vitamin D for fighting off some bacteria and viruses. Okay, so these are the main areas where vitamin D has to function. So from where do you get the vitamin D? Okay, through your skin, through your diet, through supplements. There are three ways in which you can get adequate amount of vitamin D: your skin, your diet, and your supplements. Okay. When you expose your body naturally to sunlight, exposure to sunlight does not give you vitamin D. You have vitamin D derivatives under the layers of your skin. Sunlight just activates it. Okay. Sunlight will activate the conversion of vitamin D into an active form that can be absorbed and utilized by the body. Okay. But too much of exposure of sun can also lead to other issues like skin cancer, skin aging. Okay. So those are the other fact extreme of sun exposure. And very few foods contain vitamin D. Okay, majority of the vitamin D that you get from your food is in the fortified form. Okay, if you take any packaged milk, okay, in India there are so many brands of packaged milk. Amul is the most famous one. Okay, but every state of India has their own version of packaged milk. Okay, like if it is Tamil Nadu, they have Avin. Okay, in Kerala they have Milma. In Karnataka they have Nandini. Okay, Vasudhara in Gujarat. Okay, they have Amul also in Gujarat. There are n number of brands of every state have their own brand of milk. Okay, so all this milk, if you see the milk package, it comes fortified with vitamin A and vitamin D. That is a requirement right now. By law, it is required that milk producing companies, they have to fortify their packaged milk with vitamin D and vitamin A. Okay, so from fortification also you get your vitamin D. Vitamin D is also added into the food. Okay, some food naturally contain vitamin D, like milk, yogurt, okay, cereals. Cereals also get fortified with vitamin D. Naturally, certain food that has vitamin D is egg yolk, fish, liver, organ meat. Okay. So these are the different sources. Vegetarian source of vitamin D is not available. Okay, you can only make a vegetarian source to have vitamin D is only through fortification. You have to fortify the food. For example, some cereals that you get. Okay, the cereals that you get from outside. So some of them they come fortified with vitamin D. Milk is also fortified, okay, with vitamin D. Milk also has vitamin D, but not in such high quantities. But if you fortify it, it's healthier. It's a healthier option. Okay. So vegetarian sources, no vegetarian sources naturally has vitamin D. Okay. The active form of vitamin D is not available in vegetable sources. Okay. Whatever vitamin D is available, it's an inactive form and you cannot utilize it for your body purposes. Okay. And the other form is vitamin D in the form of supplements. It's added in various multivitamin. If you take any multivitamin, you definitely are getting your vitamin D. Okay. Any form of supplements, if you are taking, you can check the ingredient list. Does it have vitamin D or not? Okay. There are two forms of supplements in form of D2 and D3. Okay. D3 is from your uh, um, animal sources. D2 is from the plant-based sources, but it is inactive. Okay. And both this type of vitamin D can be found in your blood, but D3 is much better. It is the quantity of D3 is much higher, and it is easily absorbed by your body as compared to D2. So if you're taking vitamin D supplements, make sure that you take your vitamin D supplements with something that naturally has fat. Okay. For example, if you're taking vitamin D capsule, drink it with a glass of milk, not with juice. Okay. Anything that has fat, because vitamin D is a fat soluble vitamin. Okay. So when you pair it with something, so any milk component, curd, yogurt, okay, that has fat. Okay, if you're pairing it with such kind of drinks, it is easily more rapidly absorbed. Okay, vitamin D with egg, or you're having an omelette and coffee, okay, or tea or something like that. Usually caffeine will interfere, but the dose of vitamin D that you take in form of supplement is high. Okay, so much interference will not be seen. So with egg also, you can take vitamin D. Okay. But that's why if any one of you have been on vitamin D supplements, usually your doctor must have prescribed you vitamin D granules in such a way you have to add it into milk and then have it. Has anyone taken such kind of vitamin D granule supplements? Weekly ones on the same day, like if you're taking it on Saturday, every other Saturday, you have to take the same granules, but in milk. Okay, you have to add it into the milk and then take it because it enhances the absorption. Okay. Yeah, nowadays vitamin D shots are also available. Fat will be present in that shot. Okay. So whenever you take vitamin D supplements, remember that you take it don't take it on empty stomach with water. Okay. Have it with a glass of milk or have it along with a meal. Okay. The meal that has eggs, if you are a non-vegetarian, any meal that has some non-vegetarian food, eggs, milk. Okay. Or even with the white sauce pasta and all, if you're having, you can have vitamin D. It can easily absorb from your intestine. So ergocalciferol is the name of vitamin D2. Cholecalciferol is the name of vitamin D3. That is vitamin D3 is from animal sources. Okay. Vitamin D2 is from plant sources. It is inactive molecules. Okay. It is inactive molecules. not useful for human body consumption. Okay, so that is an introduction about vitamin D. So coming to vitamin D synthesis, as I mentioned earlier, vitamin D in form of dehydrocholesterol, 7-dehydrocholesterol, is found just under your skin. Okay, and sunlight is required for especially the UV radiation from sunlight. Okay, that will trigger this 7-dehydrocholesterol. Cholesterol, it is again the derivative of vitamin D is found within cholesterol, fat again. Okay, that also your epidermal layer. Epidermal layer is the topmost layer of your skin that is able to synthesize vitamin D when you expose yourself to sun rays, UV radiation. So a form of D3 called cholecalciferol, which is again found in all animal-based sources. You eat organ meat, okay, tissue meat, all of that will have cholecalciferol. That's why vitamin D from animal-based sources is a best source of vitamin D because directly you are having cholecalciferol. When you have the tissue meat of animals, okay, if you're a non-vegetarian, if you're having like boneless chicken and all, they all have cholecalciferol because they have been exposed to sunlight. Animals have been exposed to sunlight. Their body is also undergoing the same pathway. Okay, their skin is also producing cholecalciferol from 7-dehydrocholesterol that is inactive, which is found under your epidermal layer. Okay, once you are exposed to sunlight, it it is converted to cholecalciferol, vitamin active form of vitamin D3. Okay, so when you have animal sources, animal-based food, directly you are getting this vitamin D3. Okay. So, and vitamin D3 you get from fish, meat, and vitamin D2 you will get from supplements. Okay. So through dietary intake also, the vitamin D that you get, it goes into the liver. The vitamin D that is produced inside your body also goes towards the liver. The vitamin D that you yourself have synthesized plus the vitamin D that you get from the food, both of them, they go into the liver. Okay. So liver converts cholecalciferol into calcidiol. Okay. The name is not mentioned here on this chart, but it is calcidiol. Okay, cholecalciferol will go into calcidiol in liver. That conversion will take place in the liver. And then this calcidiol can release from your liver, okay, in form of 25 hydroxy vitamin D3. Why 25? It is on the 25th carbon hydroxy atom is attached. Okay, like it is a very long chain of carbon component, this active form of vitamin D3. Okay, it is a very long chain of carbon component. On the 25th carbon chain, okay, the carbon that is on the 25th place, that has a hydroxy atom attached to it. So that's why 25 hydroxy vitamin D3. Okay, this will go into the kidney. Kidney will add one more hydroxy. Okay, liver gave only one hydroxy atom on the 25th carbon. Okay, but when it reaches kidney, kidney will give one more hydroxy atom, but on the first carbon. Okay, so 125 dihydroxy. Now it has two hydroxy, one from liver, one from kidney. Okay, so it has two. So that is dihydroxy vitamin D3. And this 125 dihydroxy vitamin D3, it acts like a hormone. Okay, it is released by kidney, but it has its effects on other parts of your body. That's why it is considered as a hormone. Hormones are also released from one part of your body, but it acts on different areas of it. The job it has to do is in different parts of the body. Okay. And hormones are always released into the blood. Okay. So that is what differentiates hormones from enzymes. Enzymes are not released directly into the blood. Okay. Hormones are released directly into the blood, and hormones are produced somewhere, but they have to do their job somewhere else. Okay. So this hormone 125 dihydroxy vitamin D3 is released by your kidney, but it has to maintain the calcium balance in the bones. Okay, so its job has to be done somewhere else. So this is how the entire process of vitamin D takes place. Okay, from your skin, inactive form of vitamin D, that is in form of 7 dehydrocholesterol, gets converted in presence of sunlight, gets converted into cholecalciferol. And cholecalciferol from animal sources and plant sources stays in the liver. Liver will add one hydroxy atom on it, makes it into 25 hydroxy vitamin D3. It can still not work. Okay. In 25 hydroxy vitamin D3, vitamin D still cannot work. It requires one more hydroxy ion. So that's why it goes to kidney. It gets one more hydroxy ion. It becomes 125 dihydroxy vitamin D3. And now it can function for calcium balance in your body. Is it clear? Vitamin D synthesis, is it clear to all? Vitamin D2 will have its another form of conversion taking place in the intestine as well. Okay. So for not just for the absorption of calcium, but also for the absorption of phosphorus, vitamin D is required. Okay. So functions of vitamin D, it helps to form and keep your bones and teeth strong because it maintains that calcium level in your bones and in your teeth, not just calcium, but also phosphorus. Other mineral levels are also maintained because of vitamin D. Okay. It helps your muscles to contract, not just your body's muscle, but also the muscles in your organs, your heart muscles. Okay, that also is able to contract and relax because of vitamin D. And that's why you can move. Okay, your skeletal system can move. And then it helps nerves to carry messages between brain and body that I have mentioned earlier. Vitamin D is able to help carry messages, help your nervous system to stay healthy and pass on the signals. Okay. It also supports your immune system to fight off bacteria and viruses. Okay. Is my voice clear to all? So there are some studies that have mentioned a link between vitamin D and cancer as well. Okay, certain deficiencies of vitamin D can lead to cancer. Okay, different types of cancer. We will see that later. So again, this is again the conversion of vitamin D and how it is utilized. Okay, so in the skin, you can see here the 7 uh, dehydrocholesterol getting activated into pre-vitamin D3. Okay. And that gets into the liver. It because in the presence of heat, it converts into vitamin D3, it gets into the liver. And liver, because of the CYP2R1, that is one enzyme, okay, present in the liver. When it acts with the when with this enzyme, it becomes 25 hydroxy vitamin D3, and it goes into the kidney. It gets one more it gets one more hydroxy ion because of another enzyme present in the kidney, CYP27B1. Okay, you don't have to remember the names of these enzymes. Okay, 25 dihydroxy vitamin D3 is formed, and this is the one that can function. Okay, it helps in bone health, it helps in the in production of immune cells. It can help, it will go and act on your liver cells as well. Okay, diet and supplement: fish, dairy products, fortified foods. This is the areas through which you get your vitamin D through diet or supplementation. It is absorbed by your intestine. If it is D2, intestine has to add, convert it into free vitamin D3, and then only it can be taken up by the body. Okay. So coming to vitamin D deficiency, rickets and osteomalacia. So rickets, it happens in children, okay, but osteomalacia can happen in adults. Okay. Here you can see how a normal child's leg look like, and how a child who is affected with rickets, how their leg will look like. It's like a bow. Okay. It curves like a bow. Okay, so and it can curve anywhere. This is also a case of ricket. Okay, so because of softening and weakening of the bones, they have this bow shaped legs. Some inherited diseases can also lead to rickets, not just vitamin D deficiency. Some inherited diseases can also lead to rickets. Okay. If the child does not get enough amount of vitamin D, their body cannot maintain proper levels of calcium and phosphorus level in the bones, because of which rickets happen. Okay. So when a child is moving towards this bow shaped legs, add vitamin D and calcium into their diet, it usually corrects their bone problems. Okay. Some surgery is also required if it is this drastic. It affects the movement of the child. The child is not able to walk or something. If the child's movement is affected, the child will require some surgical treatment to correct the posture. Okay. Treatment is there for rickets: supplementation, medical treatment, and surgical treatment. If skeletal deformity, like here you can see in this image on the extreme right side, this is a skeletal deformity. This can only be corrected with surgery. Okay, just by taking the supplements, this will not go away. The child has to undergo surgery to correct this posture. Some children are born with certain low levels of phosphorus and other mineral component in the bone. Okay, that is genetic. That is not because of vitamin D deficiency. That genetic disorder can also lead to rickets. Okay, and osteomalacia, it happens in adults. Okay, that is also softening of the bone, painful bones. Okay, that osteomalacia is means softening of the bone. So children who suffer from rickets, they will have delayed growth, delayed motor skills. They will have pain in their spine, pelvis, legs, muscle weakness, bow legs or knock knees are also seen. So usually, even children who don't get enough sunlight, they can also get rickets. Okay, these days children are engrossed in smartphones and playstations. They are not going out and playing. Okay, they're not getting enough sunlight. So in such cases also, the child's skin can produce ricket-like situation. Usually children who are in developed countries, they spend a lot of time, less time um, outdoors. They usually spend a lot of time indoors. Okay. And they are also in developed countries, children are using a lot of sunscreen from a very young age. Mothers, they just lather a sunscreen over their child. Okay. That can also block the sun's rays, which can trigger vitamin D deficiency. And if your child does not eat egg, fish, uh, non-vegetarian food, okay, and you don't give any packaged food like cereals, okay, milk that is packaged, if that is not been provided to the child, that can lead to deficiency, because fortified vitamin D you can get only through these sources. Okay. Milk, cereal, some fruit juices, beverages, milkshakes, okay, milk powders like Bonvita Boost and all. If you see their packages, they are also fortified with vitamin D. Okay, so if you want to go all natural uh, towards your child rearing approach, that's completely fine. But you have to make sure your child is getting vitamin D. If you do not want to use any form of packaged food, okay, nowadays mothers tend to do that. They want all natural solution for the children. They don't want to give anything that is packaged at all to the child. That is completely fine, but make sure your child is getting at least enough sunlight. Okay, your child is having some eggs or some other good source of vitamin D is your child is getting. Okay, milk, at least milk products, okay, at least that you are giving to your child, so that you have to take care. Vegans have to take vitamin D supplements. Vegans, strict vegetarians have to take vitamin D, vitamin B12, and calcium supplements. Okay. And some children who have other gut related conditions like celiac disease in which your small intestines villi, the finger like projections that you have, the small intestines villi is short. Okay. The small intestines finger like projections, the villi should be long, only then it can catch hold of the nutrients. So in celiac disease, your small intestines is flattened in certain areas it has short villi. So in that case, absorption of nutrients will not take place. That could also lead to deficiencies. Children who suffer from inflammatory bowel disease, cystic fibrosis, kidney issues, okay, they all suffer from vitamin D deficiency. And other issues like kids who have very dark skin, okay, they have a high chance of developing deficiency, because the darker your skin is, it will block sun rays. Okay, it will not allow the sun rays to generate that heat, which can help produce vitamin D3, free vitamin D3. Okay, so children who have very dark skin and on top of that they apply a lot of sunscreen, that could lead to deficiency. If mother was deficient during her pregnancy, she will give birth to a vitamin D deficient child. Okay, how much exposure is required, we'll come to that slides shortly. Okay, people who live in northern latitudes like countries like Greenland, Iceland, Norway, Antarctica, Arctic areas, okay, north part of Russia's, these are northern latitudes. Okay, geographically they get very less amount of sun rays, even European countries. Okay, kids who are preemie babies, premature babies, and if the child is having HIV infection, the child is on ART therapy and retroviral therapy, that is HIV medications. That could also block the absorption of vitamin D. So all the risk factors we have discussed: inadequate exposure to sunlight, having unrefined cereals, vegetarianism, veganism, prolonged breastfeeding. Prolonged breastfeeding means mothers don't stop, mothers are not giving other form of milk, okay, for a very long time till the age of 4 and 5. The child is being breastfed, and breast milk does not contain enough amount of vitamin D. Okay. Even after 6 months of exclusive breastfeeding, you still continue breastfeeding without adding any other source of milk. You have to give vitamin D drops to the child. Okay, that has to be given. Otherwise, the child will not grow properly. Okay, the child will have abnormal spine, abnormal legs, teeth development will be also delayed, bone deformities. Child may also have seizures. Why? Because vitamin D is required for the health of your nervous system, for the health of your nerves. Vitamin D is required. If you are deficient, it could lead to convulsions and seizures in children. Okay. Skin pigmentation, as I mentioned earlier, dark skin, that also has a risk of developing rickets. Because dark skin, first of all, in India, if the child is on the darker side of skin, the parents more likely will not allow the child to play outside. They will say you will get more dark, because we have that colorism in India, right? We prefer fair skin. So that is a social factor, okay, that affects vitamin D deficiency in India. That first of all, Indians have brown dark skin, so naturally sunlight will take much more time to activate vitamin D in our body. On top of that, because of colorism, okay, because of the effects of colorism, Indians tend not to stay out. Okay, only if they are daily wage workers, they don't have any other option. They have to be out in the sun for earning money. Okay, only they choose to be outside in the heat and work. Otherwise, those who are privileged, they will sit inside. They are always indoors. They will keep the children also indoors. Don't allow them to play out in the sun. Only allowed to play after 5 when the sun is setting down. Okay. Otherwise, the child will get tanned. So we have this colorism factor that also affects vitamin D levels in Indians. Okay. Then with age, the absorption level decreases. As you age, your intestine will absorb lower amount of vitamin D. Your skin will also make lesser amount of vitamin D. Okay, so with age, there is a reduction on the absorption and the formation of synthesis of vitamin D. Okay, so coming to osteomalacia, as I mentioned earlier, osteomalacia means softening of bones. There is a difference between osteomalacia and osteoporosis. Okay. Osteoporosis is demineralization of bones. Minerals are taken away. Okay. Here, minerals are away and the bone matrix is also not strong enough to hold on. Okay. So, softening and weakening of bones, imbalance of minerals, especially calcium and phosphorus, okay, which will not allow the bones to harden. And there could be pseudo fractures. Pseudo fractures means you don't have to fall down or get hurt for the fracture to take place. By your own body's weight, okay, the weight bearing bones will crack here and there. Okay, your ankles, your knees, your hips, okay, femur, these all are the major weight bearing bones in your body. Okay, so you will find cracks happening here and there because of your body's own weight. Okay, the risk of pseudo fractures is high in people who are overweight and obese. pain in lower back, hips, pelvis, and sometimes all over the body in severe cases. And the causes here, first and foremost, is vitamin D deficiency, not getting enough sun exposure, diet that is low in vitamin D, like vegans, strict vegetarians, malabsorptions during like, because if you're taking medication, okay, that affects the absorption of vitamin D, HIV medication, some antibiotics, anti-infectives, okay. Kidney diseases or kidney failure, because your kidney is supposed to make 125 dihydroxy vitamin D3. Okay, if kidney is not functioning properly, this active form of vitamin D in form of hormone will not be released. Okay, that would lead to osteomalacia. Diagnosis, medical history, physical examination, blood test. Okay, taking an DEXA scan you can do. That is the imaging DEXA scan. Dual X-ray, dual energy X-ray absorptiometry. That is a DEXA scan. Bone densitometer or DEXA scan is done. Okay, bone biopsy can be done. So that's how you can diagnose the person has osteomalacia or not. Okay, treatment, you have to give them supplements. Okay, you have to change the diet as well, give them supplements. And if the person has kidney failure, nephrologist will give medication to balance the mineral levels, hormone levels. Okay, 125 D3 hormones are also available as a part of HRT therapy. That hormones directly can be injected. If kidneys can't produce it, synthetic form of that hormone is also available, which can be given to kidney patients. Okay, so that is the treatment part. For children, one thing you can do, like you have this condensed milk, like Milkmaid and all. In India, you get Milkmaid, that is condensed milk. Okay, if you are being prescribed on vitamin D granules, just add vitamin D supplement or drop or granule into this condensed milk, a can of condensed milk, and give just 1 teaspoon of that condensed milk to your child on a daily basis, or mix that condensed milk that has vitamin D that you have added. Okay, just add 1 teaspoon of that in their milk twice a day and give it to the child. It will enhance the flavor of the milk as well. Okay, and also vitamin D requirements of your child will be met. Okay, this trick you can do if children are not having vitamin D drops or granules. And sometimes you as parent may also forget. Okay, usually vitamin D supplements on a weekly basis is also prescribed. Okay, uh, if today Monday, if today you are starting your vitamin D supplements, next Monday is your next dose. First dose is today, next dose is next Monday. Okay, like that. So you may forget. Any human being can forget. To prevent that, just open the capsule or open the granules, vitamin D granules, put it into the condensed milk, okay, and just have 1 teaspoon of it on a daily basis. So within 1 week or within 2 weeks, make sure you finish that condensed milk. Okay, either add it into the milk, milkshakes, smoothies. It will enhance the flavor and it will give you the vitamin D required as well. Okay, so this trick you can do. Or if you're getting vitamin D powder, if you're getting it in powder form, just add it into the atta that you, whatever flour or atta that you use, you can add it into that. Okay, just give me 1 minute, one moment. Sorry for the delay. Am I audible now? So again, osteomalacia is also very common in people who live in areas which does not have enough sunlight, like the northern latitudes. Okay, people who stay indoors don't expose themselves to sunlight. Okay, work, they do their work indoors. Okay, they don't see the daylight hours much, or cover themselves in clothes that cover their entire body, and there is no area that is exposed to sun. Okay, dark skinned people, and people who use a lot of sunscreen and very strong sunscreen. Okay, and also people who are lactose intolerant, they can't have milk or milk products. Vegans, strict vegetarians, those who have gastric issues, um, irritable bowel syndrome, celiac disease, same. Okay, those who have GI issues in which absorption of vitamin D is not possible, cancer. Okay, kidney failures, lack of phosphates in your diet, liver diseases as well. Just like how kidney diseases cannot produce 125 dihydroxyvitamin D3, people who have liver diseases, they cannot produce 25 hydroxy vitamin D3. Okay. People who have medications for their seizures and convulsions. Okay. People who suffer from convulsions and seizures, if they're taking medications for that, they cannot produce, they can absorb vitamin D3. Medications that are prescribed for treating seizures and convulsions. So this is the difference between osteoporosis and osteomalacia. You can see here, normal bone, how you can, how thick is the bone matrix, the black network that you see, that is the bone matrix. Okay. And inside it, the white that you see should be filled with minerals. Okay. That is a normal bone mass. The white part is the normal bone mass, and then you have the normal trabeculae. Okay, trabeculae is the bone matrix. And in osteoporosis, you can see the trabeculae is very thin. It is broken. There is no connectivity. So the bone minerals, it will just flow out of it. Okay, it's like open doors. Okay, if you don't have enough network connections, strong network connections that can hold on to bone minerals, because of this poor connectivity, easily bone minerals will get out into the bloodstream. That is osteoporosis. Okay, bones become porous. The big holes will be seen here and there on bones under the microscope. Okay, bone tissues will have large porous empty holes. Okay, here in rickets or osteomalacia, you can see there is no issue with the matrix. Okay, but the bone mass is immature. It is in osteoid form. Okay, osteoid is the immature bones. It has to get filled up with minerals. When if it is not getting filled up with minerals like calcium and phosphorus, it will stay as an osteoid, immature. Okay, it is soft because it does not have calcium and phosphorus. Okay, in osteoporosis, whatever calcium and phosphorus and magnesium that they had has drained out of it because the trabeculae, the network system was very poor. It cannot hold on to it. Here they have the network system, but they don't have anything to hold on to. Like calcium and phosphorus is not present. It's in the osteoid form. The bone is in the osteoid form. Okay. So is it clear the difference between osteoporosis and osteomalacia? So this is the recommended amount of sun exposure people with different skin tone should have. Okay. Even in India, you will find people with different skin tone from fair to medium to dark. Okay, all over India, skin tone, there is a range of skin tone that you can find. Okay, so different skin toned people based on where they stay. Okay, the exposure level is different. Okay, people who are from the northern parts of India, they will have to spend more time in outside because the latitude, sorry, the latitude changes. Okay, the latitude of South India, North India is different. In southern part of India, you get more sun rays. It is closer to the equator. Okay, and different seasons is also mentioned here. You can take a screenshot of it. Okay, different seasons, how much time you have to spend out is mentioned. So summers, people who are fair, just 10 minutes if you spend out, that is more than enough. In spring or autumn season, like what we call as monsoons here, okay, 20 minutes out is fine. In winters, 30 minutes of sun exposure is fine for fair people. Okay, medium skinned people, it is much more. In summer, 1 hour out is fine. To at least more than 3 hours in spring or autumn, that like monsoon seasons. Okay, and around 150 hours, that is about 4.5 hours, approximately 5 hours, you have to be out uh, for medium skin tone people in winter seasons. Dark skin people, it is much higher. Okay, so the darkest skin people, they will need 10 times more of sun exposure than the fairest of the people. Both will not have equal amount of sun exposure because of the melanin that is present in their skin tone. Okay. And this during this exposure, you have to make sure you're not wearing any sunscreen. You should be outside. Okay. And UVB rays that is supposed to create heat, okay, that is not able to penetrate glass. So even if you have glass walls or glass windows and you're inside and the sun rays is passing through, UVA can pass through the glass, UVB cannot. Okay, sun rays have three different types. Okay, UVA, UVB, and infrared. UVA can penetrate through glass, but it will not heat up your skin. Okay, it will age your skin. UVA will age your skin. UVB will burn your skin. So UVB has a tendency to heat up your skin, and you want the sun rays to heat up. Okay, you need the sun rays to heat you up. Okay, yes, the skin has to get that heat. Only then it can produce the pre-vitamin D3. Okay, so UVA will not heat you up. It can only age you. Okay, but UVB can heat you up, and UVB cannot penetrate through glass. So you have to be outside. Okay. Sauna cannot. Okay, sauna bath, it cannot. You need UVB light. Okay. Yeah, UVB light after 11 a.m. is strongest. Yes, higher the melanin component you have in your body, higher is the resistance towards sunlight. So that's why you need more sunlight. So coming to the sources of vitamin D: red meat, oily fish, egg yolks, tuna, liver, salmon, mackerels, tofu if it is fortified. Okay, tofu if it is made by fortified soy milk, and tofu itself it is fortified, then it has vitamin D. Milk again fortified, has vitamin D. Yogurt also fortified. Avocado and broccoli has inactive form of vitamin D. It has, but it is not at all a good source. You will have to have kgs and kgs of avocados and broccoli to get enough amount of vitamin D, which is humanly not possible. Okay. Mushrooms also, if you expose mushrooms to sunlight for 15 minutes and then cook it. Okay. Even if you store that mushroom, today you bought mushroom, you exposed it to sunlight for 15 minutes, but today you're not cooking anything, you're keeping it in fridge. Okay. You're making it after 2-3 days, it will still have the vitamin D it has synthesized. Okay. It's not the best source, it's a good source. Okay. Not enough to meet your needs, but it's a very close vegetarian source. Okay. Mushroom is a fungi. It's neither animal source, it's neither plant source. Okay. But for vegetarians, it is the most closest source. Mushrooms exposed to sunlight is the most closest form of vitamin D that they can avail. Okay. Cereals, you see here, it is fortified ones. Soy products also fortified ones only. Milk also fortified. Cheese, that is fortified. Shiitake mushrooms, it is if it is tanned. Orange juice, again fortified. Oatmeals, fortified. Butter, again fortified. White mushrooms, if it is sun tanned. Okay. So these vegetarian sources has to be fortified. Only then they can give you vitamin D, absorbable form of vitamin D. Students, please avoid direct questions. Whatever questions you have, please ask it so that others can also visualize your questions. It will benefit them as well. Okay. What kind of doubts all the participants have when you're asking it in chat, don't give me direct message. Please ask it in such a way that everyone in the group can see. Please change your settings to everyone, select everyone, and then ask questions so that others can see what questions you have asked. Okay, so when I'll answer it, everyone can benefit. Okay. Only mushrooms, okay? The vegetables we cannot synthesize vitamin D. Vegetables don't have cholesterol. Okay, so they cannot synthesize vitamin D. Only mushroom. Mushroom is not a vegetable. Mushroom is a fungi. Okay, mushroom is not from the plant group. So coming to RDA, recommended daily allowance for vitamin D. Children who are under the age of 1 or under the age of 6 months, they don't require additional because they are on exclusive breastfeeding. Okay. If the mother was taking enough amount of vitamin D during her pregnancy, okay, the child is born with enough amount of vitamin D reservoir in the liver. That is enough for the first 6 months. Later, when you start the weaning diet, add calcium based rich food, vitamin D rich food in their weaning diet. Okay, that is enough. Above 1 years of age, okay, till at your adulthood, it's 600 international units. Okay, that is what you require. And above the age of 70, when you are a senior citizen, your intake should be higher. Usually, you will be dependent on supplements. Okay, senior citizens may have to depend on supplements for vitamin D and calcium requirements. Pregnant and breastfeeding women as well, 600 international units is enough. Okay, because when you take additional milk during pregnancy and breastfeeding and you're taking care of your dietary requirements, okay, when you're taking care of your calcium requirements, automatically your vitamin D requirements are also getting met. Okay, so you don't have to pay extra attention there. But with senior citizens, they have to focus on vitamin D. Otherwise, they may suffer from a lot of pseudo fractures, hip fractures. Hip fractures are why it is common in older citizens, senior citizens, because their vitamin D levels have come down, calcium levels have also come down. Okay. Vitamin D toxicity, it's very rare. It never happens just in one day. Okay, vitamin D toxicity happens, or other name for it is hypervitaminosis D. Hypervitaminosis D. Okay, so to consuming to diet that has too much of vitamin D, okay, or consuming food that is too much fortified with vitamin D, okay, can lead to toxicity. It's usually because of supplements. Your diet or exposure to sunlight will never put you in a toxic situation. How much ever you expose yourself to sunlight, it will never reach up to a toxic levels. Okay, but supplements, consuming too much of vitamin D supplements can push you into toxic levels. Okay, because your body can regulate the amount of vitamin D it has to synthesize when you're out in the sun. Okay, and even fortified food also, what do you mean by fortification? Fortification means we know how much an average person will consume. And even if the average person is over consuming this particular food, it should still not be toxic. That's how the fortification is done. That's how minimal amount of vitamins and minerals are used in fortifying food so that in no way it will lead to toxicity in the population. Okay. So fortified food and sun exposure can never give you toxicity. What can give you toxicity is supplements. Okay. And also buildup of calcium. Too much of calcium in your blood can also is a result of vitamin D toxicity. Kidney problems, bone pain, liver problems, calcium stones. Okay, that can also be a symptom of vitamin D toxicity. So what is the treatment here? You have to stop taking vitamin D supplements immediately. Okay. And your doctor may put you on some IV fluids, some medications, some steroids like corticosteroids, bisphosphonates. Okay. These medications will be given to you to combat the toxicity. Okay. If you take dose higher than a dose that is higher than RDA, you can see the RDA here. Okay. This is RDA means what? It is already the upper limit. The numbers that you see here, 400, 600, okay, international units, the number that you see here, it is already the upper limit. If you cross this number, okay, instead of 600 on a daily basis as an adult, okay, on a daily basis, you are taking 800 international units of vitamin D. Within few months, you will reach a toxic level. Okay, so this RDA is already the upper limit. We say, right, what is the range minimum to maximum? So RDA is always the maximum that you are allowed to take. Recommended daily allowances. This is what you are allowed to take. Don't go more than that. You can stay inside it, but not too much less. You can stay around this number inside, but don't cross this number. Okay, so that is recommended daily allowances. You're allowed only till here, not more than that. Okay, because if you take more than this, that will lead to toxicity. Pregnant women can definitely take vitamin D supplements, but get a complete vitamin panel test done. Okay. So the symptoms of vitamin D toxicity: dizziness, loss of appetite, increased thirst, headaches, fatigue, nausea. It's also subjective. Okay. The symptoms that you see is also very subjective. So that's about vitamin D. If you have any queries, we can discuss the queries now.